Welcome to this video on electromagnetic neurotechnologies for structural brain imaging, where we will explore the fascinating role of electromagnetic fields in advanced brain imaging techniques. Structural brain imaging is a cornerstone of modern neuroscience and clinical diagnostics. This presentation will guide you through three technologies: magnetic resonance imaging, MRI, microwave brain imaging, and computed tomography, CT. These technologies leverage unique electromagnetic principles to provide detailed insights into brain anatomy. First, we will delve into the physical background of these techniques, starting with MRI and its and RF electromagnetic fields. Next, we will explore the emerging field of microwave brain imaging, which employs gigahertz frequencies for safe and portable imaging solutions. Finally, we will discuss CT imaging, which uses high-energy X-rays and tomography for fast, accurate diagnostics. At the end, we will compare the reconstructed image characteristics of these technologies to understand their strengths and limitations. Let's dive in. Before diving into each imaging technique, let's position these technologies within the electromagnetic spectrum. The spectrum encompasses a wide range of frequencies and wavelengths, each with distinct properties. Magnetic resonance imaging, MRI, operates in the radio frequency, RF, range, around the megahertz. This frequency allows deep penetration into tissues with minimal energy absorption, making MRI a non-invasive and safe option. Microwave brain imaging works at gigahertz frequencies, offering a balance between resolution and penetration depth. Computed tomography, CT, uses high-frequency to provide exceptional resolution but at the cost of higher energy and ionizing radiation. The relationship between wavelength, lambda, frequency, f, and the speed of light, c, is a fundamental principle here. Lambda equals cf. This equation highlights how higher frequencies yield shorter wavelengths and higher resolution, which are ideal for fine structural imaging, while RF waves are better suited for deeper, non-invasive imaging. Magnetic resonance imaging, MRI, is a revolutionary non-invasive imaging technique, as illustrated by the images on this slide. In the top left, we see a cutaway view of an MRI scanner, which highlights its key components: the superconducting magnet, B0, gradient coils, RF coils, and the patient. Together, these components create a powerful system to generate detailed images of internal structures. The diagram in the top center explains how the hardware functions. The static magnetic field, B0, aligns hydrogen nuclei in tissues, while the RF electromagnetic field, B1, applied via, excites them to resonate at the Larmor frequency. After the RF pulse stops, the nuclei relax, emitting signals captured by the receiver coils, as shown in the schematic. The top right image details advanced RF coil designs like birdcage coils and resonators, which enhance the uniformity and efficiency of the improving image resolution. The conductive shield around the coils reduces interference, ensuring signal quality. In the bottom left, we see how MRI images are constructed. Tissue is divided into voxels, and the magnetic moments of hydrogen within each voxel produce signals that are mapped into pixels. Signals are processed using Fourier transforms, as shown in the flowchart in the bottom right. The data transitions from signal acquisition to K-space and finally to reconstructed images, slice by slice. Together, these images demonstrate the harmony between MRI hardware and image reconstruction processes. MRI's ability to safely capture high-resolution images of delicate tissues, without ionizing radiation, is what makes it indispensable in fields like neurology, oncology, and pediatrics. Next, we have microwave brain imaging, a cutting-edge technology that uses microwaves in the gigahertz frequency range. Unlike MRI, as depicted in the slide's top left illustrations, microwave brain imaging is portable, cost-effective, and ideal for use in out-of-hospital environments. Let's explore how it works. The top diagrams illustrate two primary microwave brain imaging methods. The first is microwave radiometry, which relies on passive antennas, as shown on the left. These antennas detect thermal radiation emitted by tissues. The signals are processed to measure temperature changes, providing insights into blood activity. For example, the thermal conductivity detected by the radiometer is proportional to changes in tissue activity, offering a non-invasive way to assess brain function. The second method, reflection analysis, shown in the middle top illustration, uses active transmission. Antennas transmit and reflections caused by tissue boundaries are analyzed. The time of flight, TOF, equation, TOF equals 2dc, calculates the distance to these reflective surfaces. Multi-antenna setups, as depicted in the diagram of sensor points on the bottom right, increase sensitivity and resolution, make active for detecting hemorrhages, strokes, and monitoring cerebral circulation. The inverse problem path, shown in the central flowchart, highlights the complex computations required for quantitative imaging. Scattering matrices, measured by vector network analyzers, are processed to reconstruct detailed images demonstrated on the right. Finally, the frequency response graph on the bottom left shows how microwave systems operate across a range of frequencies to enhance detection accuracy. These advancements enable MWBI to detect conductivity and temperature changes as deep as 5 cm within brain phantoms, making it a powerful diagnostics. In summary, this slide captures the core principles of microwave brain imaging, its hardware, computational methods, and clinical applications, demonstrating its potential as a revolutionary diagnostic technology. Finally, we explore computed tomography, CT, one of the fastest and most accurate methods for brain imaging. As shown in the top left illustration, CT relies on X-rays, which are high-energy electromagnetic waves. These X-rays pass through tissues, with their intensity attenuated based on the tissue density described by the Beer-Lambert law, I equals I0 E minus mu x, where 2 is the transmitted intensity, I0 I underscore 0 is the initial intensity, mu backslash mu is the attenuation coefficient, and XX is the tissue thickness. The middle top diagram illustrates how the CT scanner works. It rotates around the patient, shown in the photograph at the bottom left, capturing multiple projections at different angles. These projections are detected by an array of sensors, as shown in the schematic of the X-ray flat panel detector. The captured signals are processed into digital data that can be reconstructed into cross-sectional images algorithms, such as filtered back projection, as highlighted in the gridding and IDFT process in the bottom right diagram. For enhanced imaging, Xenon Enhanced CT, (SEI-CT), introduces xenon gas, shown in the top left image, which crosses the blood-brain barrier to act as a radiopaque tracer, improving the visualization of blood flow. However, CT has its limitations, including motion artifacts and difficulties in imaging dense regions like the posterior fossa. Together, the images on this slide demonstrate how CT combines hardware precision, like the rotating X-ray tube, and advanced computational reconstruction to deliver brain imaging. Despite its challenges, CT remains a cornerstone in clinical diagnostics. Let's dive into the comparison of reconstructed image characteristics for CT, microwave brain imaging, MWBI, and MRI, as illustrated on this slide. Each imaging technology offers unique strengths and limitations, making them suitable for different applications in brain imaging. First, let's resolution. The CT image on the left demonstrates its superior ability to resolve anatomical details, such as the sylvian sulcus and midbrain structures, making it ideal for emergency diagnostics. MRI, as seen on the right, provides excellent contrast for soft tissues, highlighting regions like the internal sulcus, making it indispensable for neurology and advanced structural imaging. MWBI, shown in the center, is advancing in spatial resolution and shows promise for functional imaging through temperature and conductivity changes. Safety is another critical factor. Unlike CT, which uses eyes, both MRI and MWBI avoid radiation exposure, as they rely on electromagnetic fields. This makes MRI and MWBI safer for repeated use, especially for vulnerable populations such as children or pregnant patients. Portability is where MWBI stands out. MWBI devices are compact and can operate outside traditional hospital settings, offering great potential for mobile diagnostics and monitoring in remote or resource-limited areas. In contrast, CT and MRI require large, stationary systems, as depicted in their respective images. Each technology also has distinct applications. CT, with its rapid imaging capabilities, is the first choice in emergencies like trauma or stroke, where speed is critical. MRI, with its ability to capture detailed structural and functional information, is preferred for in-depth studies of the brain and other soft. MWBI, while still developing, is a cost-effective and portable solution for applications such as monitoring cerebral circulation or detecting strokes in real time. To summarize, the interplay between electromagnetic fields and human tissues underpins the power of these imaging technologies. MRI frequency fields and strong magnets to create non-invasive, high-resolution images. MWBI leverages changes in temperature and conductivity for portable and safe diagnostics. CT employs high-energy X-rays combined with tomographic reconstruction to deliver rapid, precise imaging. Its strengths and complements the others in advancing medical diagnostics. Future innovations in electromagnetic technologies will undoubtedly make brain imaging more accessible, accurate, and transformative, meeting the evolving needs of healthcare.